What are arachnoid cysts? What are the cause? What the symptoms that they produce? How do we diagnose them and how do we treat them? A question that was from one of our followers, if arachnoid cyst can cause seizures or epilepsy. The answer to her question was yes. However, we wanted to talk more about arachnoid cyst. So arachnoid cyst typically is a sac filled with CSF, typically present in the brain most commonly. However, less commonly can be found in the spinal cord. The patient is usually born with it, so it begins from development. And at times, certain rare disorders can also produce arachnoid cyst. However, this is very less likely. Now, the arachnoid cysts typically asymptomatic. They do not produce any symptoms, and we diagnose them and find them incidentally. So the patient presents to us with certain symptoms like headaches or numbness, tingling sensation, and we do an imaging of the brain, a CT or an MRI, and incidentally we find the arachnoid cyst and has nothing to do with the symptoms. So that's usually how they are diagnosed. Most likely or most commonly, they are asymptomatic, do not produce any symptoms. However, depending on the location, if they are located in the posterior fossa, which is the bottom of the brain, in a tight place, and they compress the structures around them, they can produce symptoms. The symptoms can range from headaches, from seizures, focal weakness, numbness, and tingling sensation, depending on where they are located. However, this is rare. If they produce symptoms, then the most likely treatment it is surgical intervention to be removed or decompressed. But most likely arachnoid cysts are benign. They do not produce any symptoms. They are asymptomatic and found incidentally. Thank you.